Hello everyone, my name is Caitlin Avery. This is my capstone video, Reflection, a crucial part of the project that will enable me to evaluate my experience and identify my strengths and weaknesses presented during the learning process. This project was based on patients facing mental health issues. The presentation involved a group of individuals who have had repeated cases of mental health problems. The objective of this intervention was to increase the level of awareness and mental health problems and reduce the number of suicide cases and injuries caused by depressive disorder. In addition, the intervention was successful because it resulted in professional and personal growth and mitigation of stigmatization against people with depression. Before we began working together, Hazel was familiar with depression and its various therapies, and I offered my assistance. She agreed to take part in my program despite the fact that it required her to make significant lifestyle changes. I had told her many times that engaging in regular exercise and developing healthy coping mechanisms would be beneficial. While discussing her depression, we focused on education and the advantages of incorporating exercise and mindfulness practices into her routine. After relocating to a quieter neighborhood to escape the stress and noise of her previous environment, the 30-year-old wanted to expand her interests. Mrs. Hazel Binion felt a lot better after leaving her chaotic apartment for a more serene and supportive community. After assessing our prior session, I plan to progressively introduce new strategies for increasing physical activity and improving her mental health. I ensured her comprehension and memory by having her repeat the techniques and information we covered. Contribution of the intervention to patient, group, or family satisfaction. Patient-centered interventions that help reduce the stigma of people suffering from mental health issues are efficient and counteracts the misinformation, negative attitude, and belief about the concept. Awareness about mental health corrects inaccurate stereotypes and presents evidence-based information and approaches. For example, the education campaign counters the idea that mentally ill people are violent and disrespectful. These campaigns can either be on a local or national level. The objective of these educational programs is to reduce self-stigma, improve stress management, and boost an individual's self-esteem. Amaria et al. 2020. People often get depressed due to various reasons such as the loss of a loved one, unemployment, living in poverty, family problems, and many more. Some of the symptoms of depression include feeling sad and worthless, fatigue, lack of concentration, and thoughts of harming oneself. Educational campaigns educate people about the biogenesis of mental disorders by focusing on the genetic components of depression that result in stigmatization. The information provided during these educational programs reduces the blame placed on mentally ill people for their conditions. However, these programs can highlight the differences between mentally ill people, intensify the stigma. Social media propagates negative information about mental problems and their impacts. On the other hand, mental health advocates can use the platform to spread messages that change the perception of the impacts of this concept. Mental health literacy campaigns improve patients' experiences because the perception of their condition is oriented in a positive direction. Educators, mental health experts, and policymakers have identified the benefits of these campaigns. Evidence and peer-reviewed literature for planning and implementation. Lungjala 2020 explains that mental health is one of the most common yet neglected health problems worldwide. Mental health is a significant representation of human development. Good mental health is a contributing factor to the general well-being of an individual. Mental issues are among the leading causes of suicide globally. Therefore, evidence-based interventions are required urgently to address this issue. Lungjala emphasizes that communication campaigns and mental health awareness efforts should emphasize strategies that fill the gap between how perception affects the intentions of mentally ill individuals to seek medical help. Creating mental health awareness enables the community to consume the right and effective communication. Using campaigns and education programs to address mental health illnesses will enable mentally ill people to apply the given information in their daily life by practicing activities that promote good mental health. Mental health awareness can be spread through the media, governmental programs and policies, schools, curricula, crowdsourcing, and intersectoral approaches. For example, mental health campaigns can specify the use of personal stories and experience to indicate how changing lifestyle and adopting healthy practices could minimize the risk of depression impacts. Additionally, the campaign can be carried out through advertisements and public transport to normalize the issue of mental health in the community. These campaigns encourage people to seek medical help and improve their mental health. Zal et al. 2020 described the concept of citizenship as an intervention for mental health problems. They claim that citizenship enhances the participation and social inclusion of people suffering from mental problems, increased awareness of social factors of mental health issues, reduces the marginalization of mentally ill individuals. Citizenship enables them to acquire resources, rights, and responsibilities that help elevate the symptoms of depression. Community psychologists and therapists have a significant role in solving mental health issues. Some of the most common themes for mental health campaigns address depression due to loss, eating disorders, post-traumatic disorders, and eating problems. Communities and groups provide a safe space for mentally ill people to share their problems without stigmatizing or stereotyping. Public awareness increases the opportunities for mental ill people and reduces the obstacles they face in their daily life. Using health technology to improve outcomes. Public awareness about mental health issues can spread through social media, smartphone applications, and educational campaigns. Amario et al. 2020 research to determine the effectiveness of some smartphone applications in spreading mental health information. The applications featured in a study were MOOC-IT, Mood Prism, and Mood Mission. These applications play roles such as cognitive behavioral therapy and mood monitoring. The study involved two groups of participants, the control group and the active group. The active group was allocated with these apps and their performance was tracked. The results indicated that a significant proportion reduced the active group's depression compared to the control group. This proved that mobile phone applications are beneficial in minimizing depressive symptoms. Carr and Ponce, 2021, described telemental health, which is the treatment of mental health problems using technology. Their study examines the reviews of elemental technology and its effects on therapeutic alliance. This can be maintained through different communication technologies. This study indicates that physicians are always more concerned about therapeutic alliance than patients. Therefore, it is recommended that approaches that will help mental health specialists increase their mental health awareness be established to facilitate treatment through elemental technologies. Impacts of policies on planning and implementation. Some of the policy issues that affect the planning and implementation of educational campaigns about mental health include primary care funding and incentivized arrangements. The United Nations Human Rights Council posits that the right to health covers all factors affecting health, such as access to safe and accessible healthcare services, education, and information. Zal et al. 2020, the right to health consists of a plethora of freedoms and entitlements. The freedom concept involves the ability of an individual to control their health and be free from non-consensual treatments and experiments. Entitlement involves the right to protection and equal opportunities and access to the best health standards. Nurses' influence on policy making enhances the quality of mental health treatment and access to resources and opportunities. Nurses are active in developing and implementing policies that deal with mental health problems. Nurses must acquire the necessary skills through training to address these issues due to their professionalism, ethics, advocacy skills, and experiences. Nurses comprehend the levels of power and know who is in control of resources and health services in their agencies. Nurses must be engaged in policies that impact their own patients, families, and the healthcare system. Nurses' impact on health policies ensure that patients are safe and increases care quality and organizational outcomes. Nurses' roles such as decision-making, analysis, control, and budgeting are crucial in mental health treatment. Contribution of project to policy development. Mental health policy is a statement that specifies values, goals, and principles of practice. These policies are implemented to legislation, approaches, programs, and mental health plans. When these policies are adequately implemented, mental policy development is enhanced and the burden of mental health issues is mitigated. These policies have changed over a long time, including adopting a comprehensive mental health action plan to enhance the development of mental health policies and institutions. Even though these policies have been changed over the years, some organizations like the World Health Organization possess their mental health policies. The components of policy development include service organizing, provision, and quality. human resources, advocacy, training, surveillance, administration, financing, and legislation. Service organizing involves the planning of mental health services. Service provision is the promotion, rehab, affordability, and accessibility, prevention, and treatment, while service quality includes accreditation of interventions and strict adherence to service standards and guidelines. Human resources include the number of nurses per patient, availability of education and training. Additionally, policy development includes legislation involving human rights for patients in and outside the health sector. Zhao et al. 2020. Advocacy for mental health includes education regarding stigma and empowering patients. Administration and policy development includes coordination amongst stakeholders in the healthcare system. Designation of roles and responsibilities. Surveillance that involves establishing health information systems and collaboration. Finally, funding and budgets involve financing plans and service payments. Efficiency and effectiveness of the Capstone Project. This Capstone Project has been successful because all the learning goals were achieved. Mental health was identified as a patient, family, and population problem. The information gathered regarding this concept enables me to meet the objectives and expectations. This project presented the interventions for addressing mental health problems. The primary intervention is education and public awareness regarding this topic to enhance the mitigation of stigmatization of individuals who have a mental illness. This intervention applies to all sectors because awareness provides factual information and eliminates misconceptions and myths about a particular condition. Amiria et al. 2020. Spending time with individuals who have experienced mental health issues, especially depression, has molded my perspective on this topic. One-on-one meetings with the patients enable me to acquire first-hand information regarding the impacts of mental health problems. Additionally, evaluation of this intervention from various literature provides that spreading awareness of mental issues and their impacts using various technologies positively impacts mental health. Acquiring the correct information prevents people from stigmatizing mentally disabled people. Mental health awareness campaign increases the nature, magnitudes, and treatment of mental disorders, either individually or general population, which facilitates the ease of treatments of such conditions. Campaigns aim to reduce the social stigma that defers individuals from seeking medical interventions. Stigma and discrimination have been associated with mental illness, resulting in worse effects than the state itself. These campaigns seek to start conversations between different stakeholders to enhance collaboration and promote mental health awareness. Personal and professional growth throughout the project. This project has enabled me to reflect on the contribution of the proposed intervention and its impact on mental health. Additionally, creating this video and doing other assignments enhanced my learning abilities during the process of gathering information regarding mental health. The intervention was developed to implement the theoretical frameworks in mental health. During this process, my professionalism, ethical perspectives, and standards were improved through experience, different viewpoints, meanings of different concepts, and the possible actions that would provide a consistent solution. Zhao et al. 2020. Furthermore, this learning process has instilled conduct and character factors that help me comprehend myself as an individual and strengthen my ability to familiarize myself with new topics. Moreover, this project has developed my fluency and accuracy in research. Conclusion: mental health interventions such as a public awareness through education and campaigns require the applications of technology and professional and ethical standards. Collaboration among different sectors also increase the efficiency of any suggested intervention to treat and manage mental health problems. Additionally, policy developments in the involvement of care providers in policy development are essential for the efficiency of the suggested interventions. Applications of evidence-based practices and literature to analyze the problem of mental health increases the chances of success. Implementation of interventions at a national level will increase the number of participants in this program, thereby enhancing its efficiency. It is also essential to consider the feedback of patients to achieve patient-centered treatment. I want to thank you for your time. Thank you.